Researchers find intimate partner and sexual violence prevalent among male trauma center patients. 1 out of every 6 men who present to trauma centers is a survivor of some form of violence, with 1 in 20 have experienced both intimate partner and sexual violence, according to a study by researchers at the University of Miami, Miller School of Medicine, and 4 other institutions. In addition, men affected by penetrating trauma were slightly more likely than women to screen positive for IPSV, which in turn was associated with increases in rates of mental illness, substance abuse, and trauma recidivism. Tanya Zackerson, an associate professor of the DeWitt Daughtry Family Department of Surgery's Division of Trauma and Surgical Critical Care at the Miller School, was the instigator of the research and first author of the study. I remember taking care of a young man several years back, she said. He was in his early 20s, but he looked so small and so very sad. The patient had just had a dispute with his girlfriend, who had ended their relationship. He came to our trauma center because of a self-inflicted stab wound. I remember wondering how often we saw trauma patients, both male and female, as a direct or indirect result of intimate partner violence. Zackerson and her colleagues, with the support of on-staff social workers, then began universal screening of all patients, regardless of gender, age, background, or mechanism of presenting injury. To understand how often they had experienced intimate partner violence, they quickly expanded their questioning to include a screen for sexual violence. We were blown away by the results, said Zackerson. We found that 14% of our overall sample of trauma patients at Jackson Memorial Hospital's Ryder Trauma Center screened positive for intimate partner violence, with 8% screening positive for sexual violence, with no statistically significant difference in the rate between men and women. We quickly decided to expand to a multi-center trial, adding trauma centers in California, Florida, Georgia, and Texas, and found similar results. That intimate partner and sexual violence is prevalent in all trauma patients. We're not aware of any male-only studies in the United States on intimate partner violence in the trauma population or the associated sequelae of such violence, said Zackerson. Our objective was to perform a subgroup analysis of our affected male cohort, as this remains an understudied and neglected group in the trauma literature. One reason is that IPSV is generally underreported by men due to issues of shame. A 52-year-old male survivor of sexual violence in our study told us, "Not even my wife knows." The researchers compiled and analyzed statistics related to the 1,281 men of the 2,034 patients who were admitted to 4 participating Level 1 trauma centers over the course of 12 months. Of this cohort, 9.3% screened positive for intimate partner violence, 14.1% for IPSV, and 6.5% for sexual violence in the previous 12 months. A categorical analysis of the HITS, hurts, insults, threats, screen found the percentage of men who were physically hurt was actually higher than for women at 4.8% compared to 4.3% respectively. The total proportion of men who presented with any history of intimate partner violence, sexual violence, or both, IPSV, was 15.8%, or more than 1 out of every 6 men. We know that intimate partner violence is bidirectional, at times affecting both partners in a relationship, said Zackerson. We postulate, however, with regards to the association with penetrating trauma, that it is possible that men who experience shaming, in particular, tend to have this rebound engagement in perceived hypermasculine activities, such as firearm-related violence, leading to societal-level violence. We feel it may lead to multidirectional violence, not just bidirectional.